Well, according to the National Eating Disorders Association, about 30 million Americans will experience an eating disorder in their lifetimes. This week is National Eating Disorders Awareness Week. It's a time to bring attention to the disease. And we're joined live in studio by Dr. Ashley Zucker. She's a psychiatrist with Kaiser Permanente San Bernardino. Thank you so much for being with us this morning.
Thank you so much for having me.
Eating disorders, it's something we hear about a lot, but people have such different eating habits. How do you even know if you have an eating disorder?
Yeah, it's a very good question. I think something that's really important is that eating disorders really run a spectrum, right? So for some people that's eating much too little, some people that's eating too much, right? So I think what we really want to focus on is how much is it really taking up your time, your energy, is it preventing you from being able to do other things? Is it impacting your health in other ways? Those are some of the key factors to really think about.
Okay, and who's most at risk for them?
So really eating disorders know no bounds.
Okay.
So all ages, genders, races, you name it. But the sort of highest risk is usually around that kind of end of adolescence, early adulthood area. And for the most part, we see it more in women, but some of that may just be underreporting in other, genders and things like that.
Yeah, and I was asking you before we came on, do you even see many people seeking treatment for eating disorders?
Yes and no is what I always like to say.
Yeah.
So a lot of people who have eating disorders actually don't want treatment necessarily. Sometimes there's a connection with really wanting to kind of hold on to that eating disorder. And there can even be awareness that they don't know that they have an eating disorder. Usually it's family or friends that might be bringing them in, or they went to their other physician and they noticed a problem, and so they encourage them to come in. But the key is really asking people. So they might present for something else like anxiety, and you really have to make sure that you're doing a full history and assessment to ask about their eating habits.
And you mentioned anxiety. I'm sure there's other things that are connected with having an eating disorder, but what causes you to have an eating disorder?
Well, it's multifactorial like most things. So, there's probably some genetic component, probably some environmental component. So it's hard to say there's exactly one thing. But I do think, we have to think about sort of the culture that we live in and all of the influences that are constantly on us about our eating, about our body, about all of those things that, really kind of rain down on us all the time. And I think that puts everybody at a little bit of high risk.
Our relationships with food. So how does the relationship you had with food growing up in your home impact you having or not having an eating disorder?
Well, we know one of the key things in terms of prevention of eating disorders is actually things like family meal times. So it seems kind of strange, but there's actually some evidence that people that actually sit down, have meals together as a family, as opposed to that sort of rushing and, running out the door and eating something, that can actually make a big difference.
And when would you say someone should go for help? Because we all go through phases. Maybe you're sad and so you stop kind of eating for a little while, or maybe you eat too much to cope with something. At what point, though, does it become an eating disorder that you should seek treatment for?
So usually we're really looking at sort of a prolonged duration. So, if it's at least more than 2 weeks of really ongoing issues, but again, we want to think about that impairing factor. So is it really preventing you from being able to do your regular activities, work, school, whatever it might be? That's another key point we want to look for too.
And as far as treatment, what are the options, and can someone completely get over this?
Yeah, I mean, eating disorders can be difficult to treat, so early intervention is key. The sooner we get in there and really start to help someone, the better. Some of the key treatments are really therapy. There's multiple kinds of therapy that can be helpful, and in some cases medicine can be helpful, but we're usually using medicine to kind of treat some of the other underlying things like anxiety, depression, things like that.
And you're here today, which is kind of telling us that this is mental. It has to all go together, it seems, for you to be able to treat that.
Yes, it does. Yeah, multifactorial for sure.
All right, Dr. Zucker, thank you so much for being with us this morning.